Thank you so much. Yeah, I think we can start as we wait for the other participants to join in. I'm so sure they will join in as we continue. So thank you so much, everyone, for finding time to attend to our bonfire chat session today. And you are most welcome. And we hope that you are going to learn maximally from this discussion. So this is our second bonfire session after we had the first one last month on the 1st of July. So it was actually about the role of the youth in the curbing teenage pregnancies. And this is the second one. It was supposed to happen last week on Friday, 28th of August. But due to some logistics, we had to postpone it to this week on now today. So today we are going to discuss about a host in quotes topic, and it's a discuss. As I introduce Ryculture, so Ryculture is a social enterprise committed to championing for and inculcating a culture of active citizenship and social responsibility among Kenyan youth with regard health and general well-being in socially conscious and sustainable arrangements. Narrowing down to now the bonfire chats that we have. So it is usually a physical fireplace that we usually have, but now due to the corona, we shift actually, and that is we stick to the name that we had previously, so that our audience can identify us. Yeah, so even as we continue, you can keep on sharing the link to your friends and colleagues that they can join in, because I do not recommend them missing such an important session. So Bonfire Chats is a discussion series for the youth and by youth for a common desire to establish foster support system for each other. In doing so, participants hope to evoke and enlighten and engage each other in creating a sustainable community. So our main objective is to provide a safe space for youth to discuss pertinent issues affecting us and come up with solutions or coping mechanisms. So today we are going to discuss about the reproductive health bill, and most or the important aspects of that. And with today we have in your screen we have two amazing speakers that you'd want to stay on board until we end the session. So ladies and gentlemen, our first panelist is Linda Kroeger. So Linda is a human rights lawyer and the program officer for the sexual and reproductive health rights thematic area at the award-winning Kenyan non-governmental organization, KELIN. So KELIN, in full, it is Kenyan Legal and Ethical Issues Kenya Legal and Ethical Issues Network on HIV and AIDS. She holds a LLB honors degree from Kenyatta University School of Law and a Master's of Law in Public International Law at the University of Nairobi. Linda is a passionate feminist and social change activist, and we are so happy to have you today, Linda. Thank you so much. Our second panelist is Jennifer Wangui. You can see her photo right there. We are so glad to have you, Jennifer. Jennifer is a Kenyan young energetic leader who is passionate on ensuring adolescents and youth access sexual reproductive health. She's a holder of Bachelor of Arts degree and a Master of Science in Development Studies from JKUAT. Yeah, she currently works with DSW. DSW in full is, she will tell us. I am afraid I am not able to pronounce it very well, but it is a in full. So Jennifer will tell us more about it. She serves there as the advocacy coordinator, where she oversees and supports the implementation of advocacy projects on sexual reproductive health and family planning, targeting youth in 16 counties in Kenya, where DSW works. So, my name is Tony Kiprono, and I will be moderating today's session. I am a third year medical student, MBCHB at Jomo Kenyatta University, JKUAT, and I am the program's coordinator for this particular bonfire chat. So I am enlightened and to see all of us here today, and we will now start immediately. Then, as we continue, my co-moderator, Dr. David, will take up some particular points so that we have an interactive session. Yeah, so thank you so much, ladies and gentlemen. So we can have general comments about the reproductive health bill 2019, as it is an intense discussion. Can be talking about this particular bill, but probably even they haven't read the bill. So the bill has different parts captured in from our speakers. So I would now let Jennifer, as you also tell us more about DSW, then go straight into the question about breaking it down in a summarized way about the reproductive health bill. Thank you so much, and you're welcome, Jennifer.
Thank you so much, Tony. Like I said, I am Jennifer Wangoi. I work for DSW Kenya. First off, I can say I'm not able to use my video because I'm running in a place where there's a very big blackout. So for me to be able to sustain my power throughout the session, I might not be able to use my video. Well, I would like to say that DSW Kenya is a German Foundation for World Population. It is based in Hanover, but we have country offices in Kenya, Uganda, Tanzania, and Ethiopia. And our major focus, we always say youth can. Our major focus is on empowering the young people with information to ensure that they, number one, access sexual reproductive health services. At the same time, are actively engaged in shaping the decisions and the policies of their counties in favor for access to sexual reproductive health rights of young people and adolescents. So in Kenya, we are working in 16 counties, and the major focus is empowering young people to engage with their policymakers, and also ensure that since the health ministry is devolved, ensure that there are more allocations and funds towards access to sexual reproductive health for the young people, and of course, providing information through the use of media, where we support young people, train them how to use media to engage in advocacy and how to use media to also create awareness among their peers. Our work revolves around, we believe that if we empower the young person, they are able to help shape the discussions of sexual reproductive health in the society. Yes. Over to you, Tony.
Thank you. Okay, thank you so much, Jennifer. So, okay, I will direct the question now to. Could you please tell us about the Reproductive Health Bill 19, so that we can to understand it from what it contains for those for everyone before we can go to the specific parts of the bill. Yeah. Did you hear what I said? Okay. Okay.
I think Jennifer can't get you well. Maybe we could have Linda introduce herself and give us an introductory statement from her perspective.
So I've turned on my audio and video. I hope everyone can hear and see me.
Yes. Yes, we can.
All right. Great, cool. So my name is Linda Kroeger. As intimated, I'm a human rights lawyer, feminist, working on sexual and reproductive health and rights at the award-winning KELIN. We are a non-governmental organization working to promote and protect health-related human rights. We work across a number of thematic areas: sexual and reproductive health and rights, which is where I work, women, land and property rights, HIV, TB, and key and affected and vulnerable populations, health and governance, and across our thematic areas, we use strategic litigation to be able to build precedents on all right to health related matters. So without further ado, the reproductive health bill at the Senate has created quite a bit of conversation, and as you'd intimated before, David, it's quite a hot topic. But maybe just to give a bit of history in terms of the various versions that we've had of the bill at various legislative levels before the Senate RH bill, which is currently being sponsored by Senator Keheka. So there have been quite a number of versions. Senator Keheka's version comes right after her predecessor, Senator Sijeni, who also had an RH bill at the Senate during the previous House. There have also been other versions that have been at the National Parliament. All have fallen under Honorable Millie Mabona, who is also the sponsor of the Assisted Reproductive Technology Bill that is also currently before the National Parliament. So at the moment in 2020, we are talking about two versions of the RH bill, one at the National Parliament, one at the Senate level, and the Assisted Reproductive Technology Bill at the national level at the Parliament. So this is just to say that because it is a hot topic now in 2020, it does not necessarily mean that we have not had various other attempts by legislators to be able to provide a national framework for sexual and reproductive health and rights. Moving over to the frameworks that we have that exist, our guiding law would be the Constitution of Kenya, which under Article 43(1)(a), in addition to providing for the right to health, also provides for the right to healthcare, one of the most progressive constitutional provisions that we have in the world. This is also supported by international treaties and conventions that Kenya has signed onto and that have been domesticated as per Article 2.5 and 2.6 of the same constitution. Aside from that, we pick up provisions on reproductive health from various other laws. For example, within the Health Act, we have a provision for reproductive rights. 6 and 7 are nuances around the right to reproductive health care. So really, we do not have a law that speaks towards the very vast nature and components of sexual and reproductive health and rights. With the new constitution, new as in quotes, we have had counties, we've had devolution, and counties now have a legislative mandate with due regard to primary healthcare. Sexual and reproductive health and rights are part of that. So we have a number of counties without the necessary national legislative framework guiding them, who've also had very positive reproductive health laws, just to name a few: Kakamega, Makueni, and then we have others like Kilifi, which have retracted on the constitutional provision, which makes some of their laws unconstitutional. So just give it a small context towards the situation that we have, or the state of sexual and reproductive health and rights within the country at the moment, so that our participants today are able to understand that as much as there's been a sensationalization of the Senate RH bill by anti-SRHR and anti-gender groups that are against progressive or SRHR in general as human rights, it's important to understand that the struggle for a legislative framework at the national level for SRHR has been ongoing for a number of years. Over to you, Tony, if you have a follow-up question.
Thank you so much for that introductory statement, Linda. So as we are getting into the main discussion, could you tell us the scope of what the reproductive health bill that we're having in the different houses and campuses?
So highlighting generally that sexual and reproductive health and rights is a component of human rights that's quite vast. The current laws that are before the Parliament and are before the Senate attempt to encompass certain aspects of SRHR that are vital for the Kenyans, for protecting and promoting the state of SRHR for the nation. So some key areas that are there are components of sexual and gender-based violence, components of reproductive health care, maternal care, components of access to contraception, components of access to safe abortion as guided by 26(4) within the 4 instances that have been provided for in the Constitution. So these 4 instances are when the health or the life of the mother or the woman is in danger, a health provider can be able to provide access to safe abortion. In case of emergency treatment, this is where we have post-abortal care stepping in. A provider, a certified medical provider is given the mandate to be able to give a safe and legal abortion, and also in instances where any other written law, which is why Parliament and Senate are legislating on the same, they're able to provide for other expanded provisions with due regard to access to safe abortion, and maybe also to expound on who a trained healthcare provider is with due regard to that. That's also provided for in the Health Act. So really, there are quite a number of nuances on SRHR in a number of laws that are already in operation. But what the other laws, that the bills that are now being debated at Senate and Parliament are attempting to do is provide one law that encompasses every other aspect of key SRHR issues that require urgent legislation and guidance, and also to provide a framework for the counties to be able to understand that this is the threshold at national level. So that will be able to guide them so that no one claws back on what the national framework provides. So really, they both do seem to have some semblance of duplicity, and that's why conversations as per the month of July were to have a repeat public participation where CSOs, members of the general public, any person really could be able to submit commentary on the same. And one of the things that were being explored by the 2 sponsors of the bill was to be able to merge them so that there's one, and to be able to reach consensus on whether it will be tabled at the Parliament level or at the Senate level. So it's very important to understand the history that goes behind these two bills, and also the landmark achievement it would be for us to actually have the first act of either parliament to be able to provide for sexual and reproductive health and rights.
Thank you so much for that wonderful caption of what the bills entail. So there are two different bills, both of them addressing access to sexual reproductive health services, and this encompasses contraceptive materials, family planning options, prenatal care, antenatal care, and even going into abortion services. So in that line, we look at it in terms of, I'll move with this question to you, Jennifer. As an organization, DSW, you've been working in advocacy and improving access to contraceptive health services. What are the key issues that you feel are now very critical that need to be factored in? And in factoring them in, are these bills pro them, or are there adjustments that need to be put in place? Because we realize that there are different civil society organizations as well and other factions that are opposing this bill. So what are the advances that we would need to ensure the progress that has been made is not lost, and at the same time we are contextualizing them to the society that really need the services?
Okay, thank you so much, Tony. I want to say that the reproductive health bill comes in at a time when Kenya has committed, after the 2019 ICPD conference, and Kenya committed towards, fighting teenage pregnancy, reducing maternal deaths, and also, reducing also the incidences of FGM. What we see with the reproductive health bill that has been, like Linda has said, has been a work in progress, is it is trying to address the issues that ICPD was also addressing. And let us look back at why is it important? Looking at, leave alone what we want to talk about, even in what is provided in the Constitution, what we see every day is that we are losing mothers out of, maternal death is increasing because of reasons and safe abortion. Every day we are reporting at least 7 women die, and that 5% of the maternal death cases reported in Kenya are as a result of teenage unwanted, or unsafe abortion, let's say. So if we look at it from such a perspective, and what we have seen is from the opposers, what we are seeing is they are in a state of denial that teenagers are actively engaged in sexual activities at a very tender age. What we see is if we don't address the problem, and if we don't address the problem following a very progressive health policy environment in Kenya, then we actually telling the health system or the Ministry of Health, you are on your own. Or we are telling the young girl, you are on your, we don't even care if you finish school, we don't even care what kind of a life you're going to have. And it's good that we look at it from two perspectives. Teenage pregnancy and the entire issue around reproductive health should be looked at from a multi-stakeholder perspective. What is the role of the parent? What is the role of the church? What is the role of the schools? What is the role of every other person in shaping the girl? And then what are some of the social structures that the community has put in place, for example, to safeguard or to like punish the perpetrator? Because some of the reasons why we have teenage girls is because they are being violated at home. It's because their relatives are the perpetrators. So if we don't look at what are the causes and now look at the bill as a policy or an act or a law that is safeguarding the health system in providing quality services, and now look back and say, let us as a society or as the social structures in the society, look at how are we going to ensure that we also set up, either a strategy or a way of working within our communities to safeguard the girl child. Then we will have lost. So the position of DSW, our work goes around. We understand that early sexual default is happening, and it is triggered by cultural or the orientation of a young girl or a young boy in the society. So if it is happening, what should we do about it? That is why it is important that the bill under a section on adolescent reproductive health should acknowledge and should prioritize that young people should be able to access sexual reproductive health services and information. We look at if we look at facts and we look at the data that is triggering the Ministry of Health to come up with such a bill, is because new HIV infection is affecting the young ones, the teenagers. Every day, new HIV infections is affecting the teenagers. Every day, we have, unsafe abortion happening all over. Every day, the sale of, the P2 contraceptive. So for us, DSW is looking into the bill because we know the teenagers are getting information from the wrong places. We need to provide them with the right information. And like we said, that young people are the majority, they form at least 3% of the population. How are we involving them in shaping the policies that or the decisions that are being made to in their counties? So if the challenges, if you look at NCPD's surveys in various counties, one of the major challenges that is being highlighted is teenage pregnancy and use of drug abuse. So if our young people are not informed or are not capacitated to understand their role in the budget making process, especially in the counties, and also to use that avenue to say that if the county at the county level we want to see our issues, our challenges being addressed with services. So I look at the bill from the perspective of the health, the Ministry of Health, and the Ministry of Health is mandated to provide quality health services. So either way, even if we don't even if we keep arguing about it, the Ministry of Health professional will continue to provide or the woman of reproductive age to be able to access sexual reproductive health without bias, without stigma, without all those things. So for DSW, that is why we are passionate about the thing.
Thank you so much for that. And the aspect that you brought in terms of different stakeholders within the healthcare, within the society having a role to play, is bringing me to one opposition that we've had that is very critical. In the bill, the provision for comprehensive sexuality education. And in that provision, there's a role that's supposed to be played by the schools and even the different factions, as you mentioned, the religious group, the civil society organizations, mentorship and engagement of young people in the different forums. So how do we bring these into place? Because we are having opposition, and the main argument that has been fronted by these people is that with comprehensive sexuality education, people are going to be more, the young kids are going to be more exposed to sexual content, and it will increase their chances of starting to have having sex at an early age. So how do we move at engaging them at that point? And beyond engaging them at that point, how do we bring on board all the other stakeholders to see the benefits of having this bill into place? Maybe Linda, you could give us your perspective on the same.
Thanks, David. In terms of some of the provisions that they've been able to provide with due regard to CSE and aspects of adolescent sexual and reproductive health and rights, I think this is not something that has been included in the bill out of nowhere, but is guided by the Ministry of Health Policy on Adolescent Sexual and Reproductive Health and Rights. So that's the first in terms of some of the negative narratives that have been perpetuated. Secondly, to echo what Jennifer said, research upon research upon research in the last 5-10 years shows that the age of sexual debut continues to be, I don't know whether to say to rise or to decrease in terms of younger adolescents are engaging in sex at an earlier age. Research and the data proves that, both from civil society and from the Ministry of Health themselves. As such, if this demographic is not catered for by policy and law, and in the programs that are rolled out within the community, by the state, within their schools, then we are going to lose a whole generation. We have seen the shadow pandemic that has been manifested during the COVID-19 pandemic. That's the increase in numbers of teenage pregnancies. For us to be able to conceptualize or even fathom how the lives of these young girls and young adolescents are going to change by this one monumental change in their lives. One has to look at it in the short term and within the long term, in terms of the choices that they make with regard to their sexual and reproductive health and rights. And in the end goal, and in the end, when we're looking at larger concepts or overriding concepts such as gender equality, we are never going to reach it if we're not taking care of our sexual and reproductive health and rights, and ensuring both boys and girls, men and women, and all persons are able to enjoy their sexual and reproductive health and rights, and are able to exercise their right to access relevant services and care that are pertinent and with due regard to SRHR. So I think it's been quite unfortunate that these are some of the narratives that anti-rights and anti-gender groups have been propagating within, with due regard to this particular bill. And it's important for us to understand that without the law to be able to, one, safeguard, to be able to be retributive in the sense that where there is a particular offense, someone is able to be held culpable for violating SRHR components or provisions within said law, then we are going to maintain the cycle of continuously violating women and girls, who are the majority when it comes to SRHR violations, and just generally persons who are not able to enjoy their sexual and reproductive health and rights. We don't even have to get started on conversations around SOGI communities. Within this COVID-19 pandemic, we have not been able to document whether they've been able to access services. We have data that's relevant to other persons, but when we do have the time, when we do have the intent to be able to document access across the board for everyone, then we'll realize that the problem is much bigger and has been exacerbated, most especially during this pandemic. So it is pertinent for us, aside from existing policies, aside from existing programs, to be able to have a legal framework, not only to safeguard, but to hold accountable those who are mandated by law to provide for SRHR services and care and have not yet done so.
Thank you so much for that. When you're linking it in terms of having access to these services, that's a very important bit. And the comprehensive sexuality education, the argument that we have, you've mentioned it very clearly. We need to look at research. Research is guiding us in terms of what evidence exists as to whether people are having sex at an early age or later compared to the current trends. And in either way, with comprehensive sexuality education, it doesn't determine the point at which they start engaging in sex, but it prevents them from having the untoward events or the unwanted outcomes of this sexual debut in terms of teen pregnancies and unwanted infections and all that. So it's imperative that we have to move as a group of individuals and ensure that there's access to this education. That's a very important bit. Now I'll be moving to you, Jennifer, on the same note, not aligned to comprehensive sexuality education, but another very important bit, because initially from the discussion that Linda brought in, the reproductive health bill is a caption of all the other provisions that had been there in the Constitution, in the different health acts and laws. But now it's being brought into a single document. You hear most of the people opposing the reproductive health bill are more aligned to the issue of abortion, termination of pregnancies. What does the current reproductive health bill provide for? And is it really what we made to believe as a society based on our social norms? And what is the way forward?
Well, maybe I can start by saying that the reproductive health bill,
yes,
it's borrowing what is in the Constitution. It's not going far away from what is in the Constitution. What I would like to say is, I think the whole problem has actually even been on the way it is being given a nickname. When you start calling it an abortion bill, who will look into it? So what I would say is the bill is borrowing on, for example, on the issue of teenage, termination of pregnancy. It is borrowed from what is within the Kenyan Constitution, and the provisions are very clear in cases of emergency. So we are not saying that we are not bringing in a new concept. We are actually using what is within the Constitution to give the service provider mandate to provide termination of pregnancy when there is a higher risk of either the mother or the child, and it has to be assessment that it has to be done. So we're not telling people, but even with what is within the Constitution, look at the number of cases of abortion that are being conducted every day. And when we talk about the cases of, we are going to the private sector. And if we are not able, for a young girl who is maybe between 10 or 24, she will go and be told by her friends, okay, go and do work, you can swallow whatever, and in the process, they even die. So the bill is actually telling Kenyans, every citizen has a right to access, sexual and reproductive health, and also in cases of, for example, the need to terminate pregnancy, then the process is going to be done in a safe environment, and we are going to ensure the safety of both the mother, or maybe even, especially the health of the mother. So when we look at the provisions within the bill, they are actually aligned to the, I will reiterate what Lina says. There's the reproductive health policy, and there's a adolescent and sexual reproductive health policy that is being used to ensure that young people access sexual reproductive health. So the bill is just, it provides an overview of what the health department or the Ministry of Health has been using or has been referring to while providing these services. So it does not go away from what is within the law. It does not contradict the law. Unfortunately, now somebody else who does not understand the law, or who is not conversant on the data, that it will actually scream and say this is not the right thing. But look at, and does not have actually the data. So research has happened, doesn't have the data on what is happening, doesn't know what is being provided or what is allowed within the law, but is opposing it. So that's why I brought out the issue of, if this bill is supposed to support the quality delivery of services within the health facility. So moving out of the health facility now, let society put up structures where they are going to either mitigate, number one, unwanted pregnancy, number two, ensure that perpetrators of, for example, SGBV are, or gets to either be prosecuted, or there is a system that will ensure that they don't repeat it again. But what we are seeing is, we will oppose the whole bill, but we are not opposing, or we are not actually saying, let us ensure that communities safeguard or ensure that any perpetrator of SGBV is actually, I don't know if it's excommunication or is jailed and jailed for life. We are not taking that position. So we are looking at the problem from a different perspective. We are not looking at it from what caused the unwanted pregnancy, what caused the girl to go and procure an abortion, what caused. So if we start looking at it now, then we move from the health, and now we come to what is the role of the society, and then we come to the structures within the society and start saying, what is the role of the church? Yeah, even in developing the comprehensive sexuality education, how can the church use the information that the Ministry of Health has to ensure that they empower, they educate the young ones on, age-appropriate sexual reproductive health? How can the school, let us have this discussion at community level? Because when we move to our communities, even as we oppose the whole bill, if we move to our communities, we will be the same path. We will be the same people attending to harambees of, that girl who was trying to procure an abortion, or that woman. We will be the same people attending the funeral. We will be the same people. Those things are happening within our communities. So when we talk about stakeholder engagement now, let the opinion leaders be the drivers of what do we want to see, how do we want to see our society to look like. Some of the reasons for example, early sexual rebirth is because young girls are being, married off at a very early age. What is the society doing about it? Or are we sitting down and saying, oh, that girl needs to be married off, but when now she wants to procure an abortion, we are saying it is an offense? Why don't we start first addressing the cause? What caused this unwanted pregnancy? So maybe, David, you can also elaborate if I comprehensively address your question so that I can. Yeah.
Definitely, you've done justice to that question. Because you look at it in terms of us looking at the bill, the first thing that you mentioned is the terminology that is used. When we term it as an abortion bill, nobody wants to look into it. But at the same particular moment, they're not looking at the context and the contents of that bill, which is very important. The name of the bill will not play a role when we look at access to services and much. But once we polarize the society towards not reading about the contents of the bill and getting provisions that are addressing our needs as a society, we're already losing the battle. And then the aspect now in terms of stakeholder engagement, the communication bit and the information that people need to get. When we engage communities and give that information to them, that is when different stakeholders will realize this is the role we can play within this space, and this is how we need to champion it, looking at the problems that they're facing at that particular level. So it's up to us, all the people who are part of this discussion, who are listening in, we have to give that information in an objective manner, knowing what really needs to happen. We need to stop teenage pregnancies. That is a very important thing. Beyond teenage pregnancies, we need to look at the effects of abortion and unsafe abortion services. Are there provisions for the same? And on that, I'm going to get to you, Linda. In terms of the abortion services that are being provided for, what are the conditions that are outlined in the law, the major exceptions?
So as earlier intimated, Article 26 of our Constitution provides for 4 instances where someone can access a safe and legal abortion. So this particular provision is what we call a restrictive. It doesn't fully declare abortion illegal. So it only permits it when the life or the health of the woman is in danger, in instances of emergency treatment, and if any other written law requires or provides for one to access a safe and legal abortion. In the instances related to the life or health of the woman, this is in the opinion of a trained healthcare professional. And as I intimated, Section 6 of the Health Act of 2017 of Kenya is able to provide for the levels of medical practitioners who are able or who are mandated to provide abortion services. And this is the doctors, clinical officers, and nurses, and also trained midwives who are nurses or who have gone through nursing training. So that is able to provide some sort of guidance for instances where access to safe and legal abortion are provided. So we see that the constitutional provision provides for a balance where the trained healthcare professional within a particular level of training is able to assess a situation, and as per their medical training is able to offer these services. It is pertinent for us to understand that because of the high incidences of unsafe abortions, abortion sometimes is perceived by this society as an elective procedure. We forget that this is a medical procedure. It is something, or it is a procedure that is performed by persons or professionals who have gone to medical school for very, very many years, for them to be accredited and to have the proper training to be able to perform a safe and legal abortion. Worldwide, we have 56 million abortions on estimates as guided by the World Health Organization that are performed annually. About 22 million of these are unsafe worldwide, and majority of this number constitutes for the developing world, where we are part of that demographic. So that tells you there's still quite a bit in terms of not just legislative framework, but being able to debunk myths and misconceptions that are associated not just with abortion, but with other components of sexual and reproductive health and rights. Because as much as SRHR is vast, it is all interrelated. As we were talking about young adolescent girls accessing unsafe abortions, this is because of the early unintended pregnancies. Some of the cases you're able to trace are due to sexual offenses. Someone was raped, someone was defiled. Then they ended up being pregnant. It's a senseless state, and this is something that was envisioned when we had Petition 266 of 2015. The story of JMM. JMM was a young minor, a young adolescent girl, was defiled. She didn't know where to turn to in terms of being able to share what had happened to her, seek justice, be able to get proper treatment. Eventually, she realized that she was pregnant. in that sense of being able to comprehend, you can imagine yourself at the age of 14, thereabouts, not being in such a position. What would you have done? We have not equipped our adolescents on proper SRHR, due in part to the negative narratives and to the sensationalization of SRHR. We don't understand that at some times, at some points, or in some instances, most instances, it's a life-saving access to care. So JMM went to a quack. She got an unsafe abortion, of which she reacted badly to. And finally, when she was in a position of dire need, she was able to share with her mother. They went to quite a number of health facilities, both county level and even national. They went to a total of four, if I'm not wrong, 4 or 5 health facilities, and eventually ended up at the Kenyatta National Hospital, where at that point the reaction or the infection sepsis caused by the unsafe abortion had already affected her kidneys. So by the time we got the very progressive and landmark judgment in favor of JMM in 2019, JMM was no longer with us. And this is the state of just one young girl who was able to be identified. How many more are out there because we refuse to debunk myths and misconceptions associated with sexual and reproductive health and rights, because we are not able to properly raise awareness on the legal frameworks that promote, protect sexual and reproductive health and rights. I think we owe a really big apology to the women we've lost, the girls we've lost, because of a lot of the man-made tragedies that surround sexual and reproductive health and rights in Kenya.
Thank you so much for that. It's a very important thing that you brought a case that this is a case that we've had in our society. This is someone who lost a life because of failure to access the services that they really needed. And there's one, actually you've mentioned it in terms of people think when somebody goes for abortion, it's a choice they're making willingly. One, according to the bill that we have, there are provisions that it has to be under the care of a qualified medical practitioner. And even for the terms, in terms of looking at the scope of who can perform that procedure in what conditions, there are different forms of abortion. So the different forms of abortion have different levels of healthcare practitioners who can perform them to ensure the safety of the person is factored in. And that's a very important bit that as a society, most of us are not acknowledging, and we need to get to that point of acknowledging that this is a life-saving medical procedure, and it's going to look out for the well-being of that individual. And as you mentioned, there are different provisions, the emergency condition, the risks that are involved in that kind of a well-being of the mother, failure, like abnormality in the fetus that is being raised. Probably you are pregnant, but the kid is already deformed. In the medical perspective, these are provisions that are there in the law. But we have to look at it from the point of, this is a life-saving medical procedure, and it's needed for this person to lead a healthy and productive life. And in that case, we now have to look at the provisions and know who has to provide it and where they're providing it. And from a statistic that I read at some point, it was projecting that 17% of maternal deaths that we have in Kenya are as a result of unsafe abortions. And last year we had over 400,000 maternal deaths that we had. So when you look at it in terms of 17%, that is over 25,000 ladies and women who lost their lives to unsafe abortion. Yet there is a provision that these people could have access to safe abortion, which is procured under the care of a qualified medical practitioner. So that is something that we need to look into, and that is something that we need to enlighten the society, the community at large, to know that when we talk about access to abortion services, pregnancy termination, it's not someone making a choice at their home to go procure an abortion. It's a medical procedure that needs an intervention. Otherwise, it might compromise the well-being of the lady, the well-being of the child that you want them really to keep. And at the end of the day, we are a failed society. We'll have killed another person or even risk their lives to the end of when they'll die and pass out from this world. So those are very, very important things. And now I'll be moving to you, Jennifer. We've looked at all the other things that are coming in terms of the comprehensive sexuality education, opposing factions and all. There's a new concept that is now, there hasn't been a regulation as much on it. Assisted abortion, especially surrogacy in the country. What are the provisions as per the bill, and what's your take on it as a new concept that's coming in?
Okay, thank you so much, David. I think assisted surrogacy has been, assisted reproduction has been misinterpreted, and that is where much of the heated debate is, because there's a feeling that if I don't want to go through pregnancy, I can go ahead and get a baby through assisted reproduction, or, and I think this comes in with the opposers saying that we could be promoting, other families like LGBTQ to get children in a different way. So what I would say is assisted reproduction, let us look at it from a historical perspective, that even when we go through our Bibles, we find that Sarah had not conceived for a very long time, and she relied on the house, the help, and she decided, since I cannot get a baby, let my housemaid get a baby on my behalf. So that is assisted reproduction. We have seen in our communities, and I think it's in our cultures, there are women who are married, don't get children, and I think in some cultures they are even allowed to marry other women so that they can give birth to them, for them, or those children, the children born are considered as part of the family. So assisted reproduction, let us look at it before we even get to the scientific bit of it. It is happening, and it happens and in society, everybody will say, oh, these people were not, the family was not able to conceive, but there is a way that the society has ensured that the family name grows. So looking at assisted reproduction, the whole concept is ensuring that there is the safety of, number one, consent of the surrogate mother, and ensuring that the surrogate mother agrees to carry the baby. There is an agreement that is valid, and it has to be adhered to. Then there are terms on after the child is born. For example, the commissioning parent or the parent who wants, who is going for assisted reproduction has to agree to meet the expenses of for the surrogate mother throughout the period, and that is with regard to prenatal care and other things before the child is born. We are seeing also where the person intends to get into surrogate parenthood agreement, a qualified medical practitioner has to provide a report. They have to say that, okay, the reason why this person is going to surrogacy is because the family is not able to conceive, and since they have rights, all these things are within the constitution, and I believe they are happening in our society. Just that maybe when we now use the scientific bit, people start screaming and looking at it as though this is a westernized thing, but it is happening in our society. So they have to get a qualified medical practitioner who will explain to the parties what it means, and then what kind of an agreement they are getting into, what the implication of entering into the surrogate parenthood agreement, and also in the presence of an advocate now agree on the terms between the surrogate parent and the commissioning parent. So the discussion about surrogacy is new, but I feel the bill is going beyond now. We are addressing the issues we'll be seeing in the future. We are addressing the issues that are happening, but are very quiet, and they are silent in our society. Most people don't want to talk about, a family that has not been able to get a baby. What we actually see is a lot of stigma. If you get married and 5 years down the line you don't have a child, your mother-in-law will camp in your house. That's why you had better bring a child here. So instead of doing all that, I think we have to accept that, and we have to embrace that. Our cultures had a way of protecting such a family. And what we are saying is we want to adopt this system now into a system so that we know, for example, if it is happening, it happens every day, but because we don't have a law that is speaking loudly about it, people will actually say, hey, this thing is not good, but it is happening every day. So what I would say on my part about the assisted reproduction, we are seeing beyond now, and we're actually addressing the issues in the society where we actually see, if, for example, I am not able to conceive, We have had stories even in our media, through media houses, where people speak out and say, okay, my husband is not able to, so I decided to go and get children, out of wedlock. And when the other spouse discovers, it's a whole mess. So I think assisted reproduction is actually providing us an opportunity to address some of the effects of, if I'm not infertile and my spouse is pressuring me, instead of me going out to sleep with other people or to get other children in a different way, why don't we use the medically approved process? So the whole bill is very progressive, and I believe, even if not right now, we might not be able to speak about it openly. I believe someday in Kenya, this is going to be the process that we will all appreciate, because our cultural, our tradition, our grandfathers appreciated it and actually thought about it. So it's upon us now to say, instead of, I have seen a bit of discussions on social media where we are saying, let us stop talking about sexual reproductive health as tabia mbaya or bad manners to our, let us open up and discuss these issues, because they are happening, they are affecting us, and they are part of us. So if we start telling everybody this is wrong, everything is wrong, so what is right? Let us start by saying this is the right thing, but this is not acceptable. So let us appreciate that there is something that is not acceptable, but at the same time provide a solution. So I believe the opposers of the whole bill, they're actually pointing at the wrong thing, but they're not providing a solution.
Thank you so much for that. Surrogacy, assisted pregnancy, is something that has been with us since time immemorial. It's just that scientific advances were not there at that particular point in time. So that is why we were opting for other people siring kids for us the natural way, like somebody having sex with another woman, impregnating them, like they remarrying another person. And that was their provision. Now, with advances in science, the social issues that we are facing with this, like polygamy, is there, because if I'm marrying another wife, it's a polygamous arrangement now. But with surrogacy, you're having an arrangement where someone is helping you sire a kid who will be raised in a monogamous relationship as you define it to be. So this is an advancement in science that's giving us an option. And I remember there's a feature that I watched, either it's 2017 or 2018 on Citizen TV, where there was a lady giving information on how it's happening. And the lady, that was her main business. She was the person bearing kids for other women at 100,000 at that point, I think. You could check it up online. And this is something that has been there, and it's advancement of science. It's a matter of us as a society, as you've mentioned it, talking about sex as tabia mbaya. It means nobody would ever want to talk about it, but it's happening. How are we sired when there was no sex? We are here as a product of sexual intercourse among parents and some other people. So if that is the case, then we have to accept it as a norm in our society, talk about it as something that's happening. It's proactive, like we have to embrace it as part of our humanity. Then once we do that, we'll have moved towards addressing some of the challenges that we have. Thank you so much for that bit of it. So as we are heading towards the end of the session, there are two questions that have been shared with me. I'll pose them to you. One, the corona pandemic is here, no area or person has been spared. How can we ensure there's access to sexual reproductive health and rights services is not interrupted during the COVID-19 pandemic? So maybe I'll share that with you, Linda.
Thanks, David. So like I'd intimated, with the advent of the COVID-19 pandemic in Kenya, March 2020, I think a lot of our focus shifted to being able to control and manage the pandemic within a health system that was already below average in terms of the 6 pillars of health as espoused by the World Health Organization. One of the key areas that has suffered terribly during the COVID-19 pandemic has been sexual and reproductive health and rights. We've seen a number of stories in the media from March to date, documenting instances where women were not able to access health facilities due to curfew restrictions, where those who wanted to access emergency SRHR care and services beyond or during the COVID, the curfew hours were harassed or assaulted by police. despite it being an emergency. So we saw a retraction in terms of persons who wanted to access SRHR care when it comes to contraceptives, when it comes to maternal and maternity services, when it comes to safe and legal abortion. This is documented in some of the data that has been shared by Marie Stopes International and also the Kenya office in terms of access to commodities, access to SRHR care and services. So in terms of where do we move to from now, I think it's pertinent that we take stock of where we are in terms of the state of SRHR to be able to assess the impact of COVID-19 on sexual and reproductive health and rights, and also key aspects on access to services and care. Then that will be able to inform us in terms of moving forward on evidence-based programming and evidence-based advocacy with due regard to SRHR, taking stock of where we are in terms of teenage pregnancies. Where are we in terms of access to contraceptives? There were reports due to COVID, we had a stock out of contraceptives in a number of counties. So where are we in terms of those key aspects? How do we move forward in raising awareness on key issues that's under comprehensive sexuality education? We know that our young ones have not been in school. We know that they've been at home. We know that we've had an economic challenge due to COVID-19 where we are all globally going through the pandemic and also suffering various stages of a recession. So our parents trickling down into the household, families and breadwinners are more focused on surviving through providing food more than my daughter or my son, what are they up to during the day? Do they have school? Are they reading? Are they attending classes either virtually or through the radio, through television? So we have quite a bit of gaps in terms of moving from the bottom up and the up trickling down to the bottom. So I think the first step would be to take stock and then move forward multi-sectorally in terms of being able to ensure that we are not regressing in the gains that we had made when it comes to sexual and reproductive health and rights, sexual and gender-based violence. Our Chief Justice, His Excellency Chief Justice Maraga, was able to come out openly and say that the cases related to sexual offenses coming to the courts are dumbfounding. Where are we on that? Have we been able to shift the discussion, not from, but also to include, are we able to get justice for our survivors in terms of, yes, we've provided medical care, yes, we have filed these cases in court. How many of them have actually proceeded to hearing, and are these perpetrators actually apprehended, and how far this case is moving along. So it's for us sort of a reawakening, I think, and realizing that the global pandemic that is COVID-19 has really impacted retrogressively the gains that we've made with SRHR at large. And as actors who work in the different spaces, we all have a specialty as SRHR actors. We need to take stock, then work together, state, non-state actors, individual actors, development partners, to be able to address the gaps and to be able to address the regressions and to ensure that we are promoting and protecting sexual and reproductive health and rights.
Perfect. We have a whole scope of sexual reproductive health services that are needed, and that is where we need to start from. Then what are the impacts of COVID-19 in terms of accessing all these services, from information services, the support, redress for people who have been abused or defiled, and all that. So it's a whole scope of services, but we have to start by knowing what really has been the impact. Then once we know the impact of COVID-19 and the shortfalls we have in our systems, then we now make steps towards addressing them. And that's a clear indication of the role that you're playing as KELIN as the program officer. You need the evidence to know where to act. And that's a very important thing. Thank you so much for that. And now there's another question that came in. I'll just give you both a minute or two to give us your take as before I give another participant who wants to speak up, Amina Bashir. So you'll just give me, if you're given a chance, what subjects would you add or subtract from the bill that we currently have? The two bills merged, that is one in the National Assembly and the one in the Senate. In 2 minutes, we'll start with Jennifer.
Okay, thank you so much. I want to say that with COVID now, we have actually, the national government has developed a reproductive, maternal, child health guideline that is ensuring that the provision of essential services continue. Although we have realized that actually COVID is a wake-up call that we don't have to meet physically. So the use of telemedicine is very important, and that is what is keeping the provision of services going. Although there has been a decline, the national government is actually, through the Ministry of Health, is actually making sure that the services still continue. What I would say is that the media, everybody, everywhere in Kenya listens to radio, listens to TV, or accesses information through the media. So for us to win the case against, the biases of reproductive health bill and any other bill that supports reproductive health, we have to have the media understand the kind of information they are disseminating to the citizens. So if the media does not understand, they will continue using the abortion bill, as they call it. If the media does not understand, they will continue saying bad things. So we have to bring the media on board, let them know this is what Ministry of Health works, or the provisions within the reproductive health. And that is the way we want you to communicate those provisions, because they are the ones saying abortion bill, at the same time giving us cover stories of abortion. They are contradicting themselves. At one point we are developing a bill, at the other point you are actually showing us cases of, teenage mothers in Baringo, for example, and showing us the situation the way it is. Yet when we are developing a bill or a law to ensure that we safeguard such girls, then you're giving it a very, a totally different name. So you're providing very empathetic stories, but on the other hand, contradicting what you're saying. So what I would say is the bill also should on safe motherhood should ensure that there is inclusion of respectful and dignified motherhood and provision of services to women with special needs. Why do I say this? Is because we have come a long way in terms of ensuring that our mothers receive dignified services during delivery and after, and we have seen stories about it. So the bill should capture that. I want to appreciate our president for providing a directive that any pregnant girl should be able to access prenatal services and postnatal care. So, well, he directed that. We really need to have the national government, led by the county commissioner, implementing that and ensuring that our girls get to the hospitals. Otherwise, we will reverse the gains that we have had in introducing maternal death, and all these other issues that pertains to reproductive health. So the presidential directive provides us an opportunity, not just for now, but I think it should also be captured in the bill that any girl who is expectant should access services regardless of age. Then there is a return to school policy. This bill should actually provide that any woman, any mother should be allowed to access education even after conceiving. And I know the health department has been very progressive through even the Ministry of Education in ensuring that in providing policies on ensuring that girls return back to school. But even as we speak about reproductive health, looking at the demographic gap, it is clear that many of the girls between 10 to 24 years who are still in school are already mothers. So let us have this documented somewhere, so that if we have to look at the aspects from the education ministry now, the national government will ensure the girls access services. There will be less stigma even in school, and also they will be accepted back in school so that they complete education. If we don't do that, then what we foresee, if the girl does not procure an abortion, if the girl delivers, then there are chances that she will not go back to school. So we will be undoing the gains that we said that we have 100% transition from primary to secondary. We will have so many dropouts. So for us to mitigate that, let the document, although it's more on health, let us bring out that clearly so that we are not negotiating about we are able to even ensure that the girl who is in school gets permission to go for prenatal care. The girl who is in school, the health facility provides prenatal care services on a weekend so that she is able to access the services. So I think that is something that the bill should not. One thing that I found contradictory on the miscellaneous is the bill actually provides that any person who has undergone FGM should access health services. And I was wondering, what are we saying when we say that we should allow? It's like we're telling people, okay, go have FGM. If there is a complication, come back. So that's my take.
Thank you. That's a contradictory bit, but that is something that needs to be factored in. I think we need to work towards ensuring there's no more FGM. And as we drive towards zero FGM, in case there are FGM that are continuing, one, the perpetrators or the people who are involved should have some legal redress that is being put in place. And other than that, the victims and the people who are, like the ladies who are being circumcised and all, they should now get to be given the medical care they need. So that is, we have to get provisions for both aspects so that we deter people from engaging in FGM, and at the same time, the people who need extra care as a result of or as a consequence of FGM are being taken care of, which is very important. I'll give you 2 minutes, Linda, please, just to give me the additional points that you feel should be factored in the bill or something that needs to be removed.
So I will not go into the nitty-gritties because this aspect of the propositions we made in terms of amendments for the bill are captured in a 42-paged memorandum that was shared to Senate as a result of collated efforts between various civil society organizations working on sexual and reproductive health and rights. But key among the recommendations that we made was to be able to align some definitions to already existed and accepted ones, such as who is an adolescent, as guided by the World Health Organization definition, terminology such as adolescent friendly as opposed to adolescent reproductive health friendly, which is what is in the bill, and various other definitions that already exist within international and national legal and policy framework, so that it's able to just fit in within that and there's no contradiction. Other key issues that we were able to raise was the definition of medical providers. We already have one that is provided within the Health Act, so the recommendation was to be able to adapt that and not to recreate other definitions that would be problematic moving forward. Other aspects were on marrying some of the provisions that we have in the assisted reproductive technology bill therein, so that there's no duplicity. And this is what I spoke to earlier, having been in a position where we don't have 2 reproductive health bills, but we have one that is comprehensive enough in addressing some of the key issues that the 3 are able to provide and guide. So in a nutshell, that was those are some of the key recommendations that we made. I'm happy to share some of the memorandum that we made in terms of the provisions within the bill, what is there already existing in law, and the recommendations that were made by various civil society organizations working on SRHR. But maybe also to just touch a little bit on the FGM aspect. I agree, Jennifer, there should be a better definition of what they mean in terms of access to services. For FGM, maybe they should indicate FGM survivors or persons who were not able to defend themselves or to be able to evade. As we know, this practice has recently gone underground, even though we have existing legislation in the form of prohibition of FGM Act that actually criminalizes this. We know that there are some communities where this practice is so ingrained into their culture that it has now morphed, where actors are not even aware when it is happening, what is happening, and are not able to keep track of the young girls or even women who are forced to undergo this particular harmful practice. So I think that should also be brought out clearly, and there was a conversation yesterday on social media. Actually, my colleague was just raising it today, where quite a number of women anonymously came out and said that they had undergone the cut even in adulthood, but against their will. So I think there's also a need for increased sensitization and awareness, but also recognizing that there are some who are for the culture. We all know about the case that is in court with Dr. Tetu Kamau. And that can be a whole webinar on its own for us to be able to discuss the negative impact of genital mutilation, or FGC as it's known in other contexts. I have also had the opportunity to work on FGM advocacy. I serve on the Loreto Sisters Anti-Female Genital Mutilation Project Board. And I think that there is more harm than there is good in this particular practice, and that it needs to also continue to be regulated and provided for by law, because retribution seems to now be the only way forward. Not the only way forward, but one of the key ways forward as we continue with our sensitization within the communities where the practice is most common. So in a nutshell, I think that's all from my end. Okay,
thank you so much. And those are very critical things. We need to factor every other bit of what needs to be catered for, and we have to look at what's happening in the society. And some of it, as you're talking about the cultural perception, it's something that the society has already embraced. So for us to change the trend, we have to engage the communities and make them see the alternative approach that we're providing, so that it's something that they buy into. And once they buy into it, there will be progress that we're going to make. So I'll give Amina Bashir, she's been raising her hand for a while now, a moment to speak up and tell us what she has for us, or maybe ask a question. Amina?
Hello.
Hello.
Can I just say first, thank you very much for speaking up on FGM.
Thank you.
I'm one of the survivors. This was done to me at a pretty young age, and I wasn't all for it, but I wasn't able to, defend myself because I was simply a child. But the effects are so adverse. And when girls go through their monthly periods, it's so hard. Like the cramps are twice, and you feel like nothing is coming out because they literally sew you like a cloth. Oh, okay. Sorry.
Okay.
I got a bit emotional. Okay. I wanted first to address the issue with what is it called? Jennifer, you raised the issue with surrogacy. So even though the procedure is a new technology and it seems to have advantages, but sometimes the same technology is taken advantage of. Let's say, obviously, the people who are choosing to be surrogate mothers come from a background which is not in a good financial stage, right? So maybe the people who want to appoint this poor lady as a surrogate, they won't take care of her as much as she needs to be taken care of, because at the same time, this is not a natural process, it's a scientific process. So let's say I came across this documentary in India where young mothers or ladies who are looking for some penny to survive go through this surrogacy just to get money out of it. And what are they given at the end of the day? They're given just $500, which are $50K. And if this child comes out, as a, let's say, maybe something goes wrong and the child is deformed, the parents won't take this child. And it poses a threat to this surrogate mother, because when you hold a child in your womb for 9 months, you tend to get this special attachment to the child. Now you say this surrogate mother will take this child, or the child will be left somewhere. So I would say, even though it has advantages, I think the disadvantages are adverse too. And sometimes you feel like just, the parents, like when they get this child, they don't care about the postnatal care. And it's I know it's such a tragedy, but some medical practitioners support this, as long as they're getting the extra pennies out of it. Like they'll tell the mother, oh, you can go home, whatever, but sometimes you find that this mother is unable to take care of herself because she had a complication after that pregnancy. That's what I wanted to share. Thank you very much for giving me this space.
Thank you so much, Amina. It's a pleasure hearing from you. In terms of the aspect that you're talking about issues on FGM, it's very, very critical. It's very important. I have a friend who went through the same process, the same procedure, and she's not having the best of moments. And this is a very close friend of mine. She is married and she's been going for reconstructive surgeries for the last 5 years. I've schooled with her. We are good friends. Even now we talk and all, but it's not a very, very appealing situation having your friend go through the same process. So we have a responsibility to put an end to FGM, and that calls on me and you to do the work that needs to be done. On the issue on surrogacy, there are benefits to it. And as you've highlighted, there are the drawbacks. There are challenges that are involved. Some people will get involved in surrogacy in terms of sharing kids for others as an economic activity. It's a business for them. And that is where now, in terms of the bill that is being fronted, we have to ensure the bill has provisions on the modalities of executing the surrogacy. What care does it provide from antenatal during the prenatal care up to postnatal care for the mother who is carrying the kid? In case of complications, what redress measures do we have in place? If it's not provided for, then we are going to lose the whole battle. And we'd rather not create another mess in the process of solving one problem. So that is another thing that would now count with the people who are in part of the space to look at it in terms of what needs to be done to ensure all these concerns that are being raised are not going to arise at the end of the day. And that brings it to you, Linda, Jennifer, in the different spaces that you guys are on, and on our end as Ryculture as well. We'll try as much as possible to push for health advocacy, communication and all, but you have to join hands together and support in bringing these things to light and addressing them for the entire community. So thank you so much, everyone who has been here. Thank you so much, Linda and Jennifer, for your contributions. I'll give you a last moment to give us a parting shot, a minute or so that we close the session. So I'll start with Jennifer.
Thank you so much. This has been a wonderful discussion, getting to discuss issues around the reproductive health. What I would say is we all have a role to play. Let us not point fingers to the other person. From the African perspective, it is very easy to point to the other person, but you forget you're also pointing to yourself. Let us be solution providers. Let us look into a problem and provide solutions. Let us look into a problem and provide insights on how we can address it. But if we keep saying the problem is there, we are not providing solutions, then we are the ones who are accelerating or fueling it to continue happening. So the reproductive health bill provides an opportunity for Kenya, for its citizens, and especially for its majority population, who are the young people, to decide and to design the provision of health services for women of reproductive age. So if we don't go in that direction, then we will lose it. Then number two, media is a very important component of through which we can share information and we can share accurate information. Let us use our young people, since we work with young people, to escalate these discussions outside here. And also, I think I have worked in Nakuru County and I have seen the Nakuru County bill, reproductive health bill, being trashed, just like what is happening at national level. So we need to start the discussions by providing data on what is happening on the ground and asking our decision makers, let us get practical, let us provide solutions, not just for us, not just for the votes, not just for the next election, but for the healthy future of our society, of our population. And of course, with a healthy population, that means we are able to have a more productive population. Thank you.
Thank you so much. It's on each and every one of us, very important, and we have to play that role. Then there's the aspect on media. Media has a role to play, but it's us who influence the media. What we want to consume is what the media will give us. It's a business for them, and we have to integrate the responsibility into that business that they're playing. So let's do the part. Linda?
I think for me, my part in short is on the power of knowledge and information, echoing part of what Jennifer said. Given that there is a lot of false narratives, a lot of myths and misconceptions that have been put out there with regard to sexual and reproductive health and rights in the country and in the world, given the different contexts that we have, I think it's pertinent ourselves, whatever level of information, whatever level of news that we interact with, we are able to do our own research and ascertain the verity of it. We've all seen the aspect of fake news. This is no different, where we have constant propaganda that is spread against certain key SRHR milestones, such as this RH bill that was at the Senate. So I think as Kenyans, it's pertinent for us all, and it is upon us all to be able to verify the information, to verify various things that we read online, that we hear people talk about, and to be able to have that power of knowledge and information, and not necessarily rely on misinformation, myths, and even propaganda. Another key thing to bring out is the importance of evidence-based advocacy, programming, and action, that we continue to build our data, because the numbers never lie. And if this becomes our guiding principle in any form of work that we do, whether it's the Ministry of Health in the programs and the policies that they develop, whether it's civil society in our advocacy and on the ground work and programming in our capacity building, whether it's the journalists and the media that Jennifer highlights, then we're able to portray an accurate picture and not necessarily rely on sensationalization or reacting to anything that is shared when already things have become thick, for lack of a better description. But also to talk about the nuances that result in having anti-rights and anti-gender groups stand against sexual and reproductive health rights. It all boils down to voice, choice, and agency. And the reason why for us in sub-Saharan Africa, women and girls bear the brunt of sexual and reproductive health violations and the lack of proper legislation safeguarding and protection from the law with due regard to enjoying SRHR is due to such key aspects when it comes to understanding gender roles and to be able to remove nuances of patriarchy. So with that, I'd like to leave with a quote from Sarah Gimke, where she says that I ask no favor for my sex or gender. All I ask of our brethren is that they take their feet off our necks. I think the core essence of human rights is that we are all persons. It does not say woman, it does not say Soji communities. Human rights do not talk about specific persons enjoying better rights than the other. It talks about you being a human being. And I think it's a high time that all forms of rights, all forms of human rights are accorded the same level of respect and dignity as indeed the intent of human rights is. Thank you.
Thank you so much for that. Being informed is very, very important, because once you have the right information, people won't sway you aside based on their perceptions and how they want to sensationalize the information that they are giving to you. The information is as good as the outcome of it when it's shared with you. So the question is, how will you use the information that you have access to? And that's very important. Then we are human beings, we have our rights, as she's mentioned, and you have to look at it in terms of what are the rights that you have as an individual, what makes you live in dignity, and to be healthy as a person, to be prosperous, in being at the right state of mind under the circumstances where you're living. And if we can achieve that, we'll have made the strides that we need to work towards. So Thank you so much, everyone. Thank you so much, my panelists. This has been one of the best that I've had. You guys know the content of the work that you're doing, and I really appreciate and look forward to working with you more. As we are coming towards the end, I'll give Tony a moment, the program coordinator, to just share a word and inform us there's a message that is also shared here with us. So, Tony.
Okay, thank you so much, and thank you to our two dear panelists for the great insights that give us. How I wish that the community that is being given to the famous BI should also be given to this bill, educate to the people, so that people can be able to know what is happening in terms of the various bills and a sensitive one, like this one for the reproductive health bill. So we, in the chat that I posted our link, so we usually have a group, the bonfire, so we do communications and also we usually have discussion. So if you're interested in such sexual and reproductive discussion, any group, then can further discussions and after you. Our next bonfire will be end of this month. We'll communicate the exact date. If you like us to hand a particular topic that you think is to being this particular time, then you contact either me or I, and you can even get in touch with us for our social media platforms at Ryculture, all through the platforms. So, ladies and gentlemen, it's been a pleasure having you all day, and that is how we conclude the session. You can official conclude, then we call it a discussion. Thank you so much.
Thank you so much, Tony. It's been a pleasure. Tony has been supporting the program. He's been responsible for all the coordination, and even in terms of the communication with our panelists, he's been key on it. And that's a very amazing job you're doing, Tony. I'm really proud of the work that you're doing. Thank you for that. So as he has mentioned, we have the WhatsApp group that is there. We can continue our conversations. And these are monthly discussions where we look at issues that are affecting young people. And when we really look at the issues that are affecting young people, we want to engage young people to make the change we are having in the society. Because if it doesn't happen from them, then that is where we'll have a mess when in the next 10 to 20 years, we're still going through the same sack of mess and everything that is not working right. But if we can get the right people who are going to make the advances with time, then we start solving the problem from the root cause. And that is the most important thing. So even to our panelists, our guests for the day, if you have any topical areas that you feel like from your programming, from the work that you're doing that needs being addressed by the young people and for the young people, we are willing as Ryculture to support and engage as much as we can to ensure that we get out to the people and make a difference in our societies. So thank you so much, everyone, for the people who have been following us on Facebook Live. It's been a pleasure. Asanteni sana and have a great evening. Hey, Tony.